So I'm Charu, and we're Etta, and you can access us currently on doihaveskincancer.com. The problem is pretty significant. It's the late and inaccurate diagnosis of skin cancer. 98% of melanoma deaths are preventable with an early screening, yet 20 people die per day of it. 70% of ER, primary care, and pediatric doctors neglect to investigate the 21 skin rashes, infections, and lesions that accompany deadly diseases, and 50% of clinicians are sued for this. There's difficulty in booking specialty appointments in a timely manner due to triage issues. It takes a minimum average of 32 days to get an appointment, 42 days to die of melanoma. In Alaska, firstly, snow reflects up to 80% of the sun's rays. And melanoma is the 8th most common cancer in Alaska. The average time it takes to get a dermatologist appointment is 65 days in Alaska. But like Jacqueline said, there's one dermatologist that is flown in once a month in order to take these appointments. So the booking is really chaotic. And of course, a melanoma can become deadly in just 42 days. So if you miss that window of booking, you have to wait, who knows how long, average 65 days. Etta is an AI-powered screening application that instantly analyzes a picture of a lesion on the skin to determine if it may require treatment. Post-screening, it helps patients track and monitor changes and related medication in between dermatological appointments. On the clinician end, Etta helps ER doctors identify crucial and deadly rashes and infections, and it has real-time tracking features to help dermatologists do quick full-body scans. It can be used on a phone, tablet, desktop, or voice-activated system that queries with spoken descriptors. It's HIPAA compliant and an API format to integrate into any EHR or existing telehealth platform. Best of all, it's 98% screening accurate. So I'm going to give you a demo. I think the best way to kind of show it is to actually show how it works. So here's our website, doihaveskincancer.com. It's a web application, so just click Screen Me. I already have an account here, so we can do new concern. This works well on the phone as well. You can take it right with an app. We are making a mobile app for dermatologists that are using this platform in their clinic. They wanted a native iOS app for their patients to be able to track changes in between appointments. And it worked really well for the kinds of EHR integrations that we were doing to just build it into mobile. So. Might take a second. So as you can see, this particular patient input was not screened as something cancerous. And it's being compared to a database of over 200,000 images. We work with the Colorado Dermatology Institute to build out our database of interesting and special cases. So here we also we have a partnership with Healthgrades that links into this to help people find a dermatologist. So that's our consumer-facing application, and for the clinician, we are building it as such. They already use dictation services in the office, so what we do is we collect that dictation information and use NLP to extract the symptoms from that can serve up a relevant model. So this is a case where you've got a 6-year-old patient with a fever, spotted rash, and a cough. When there's a combination of a fever and a rash, it could be something very contagious, and it could be a number of things that ER doctors don't see on a day-to-day basis, so they don't know how to diagnose appropriately. So we help them diagnose that through a differential system. So relevant questions that can help provide a differential. So Koplik spots are actually something that differentiates measles from parvovirus. It's extremely important to know the difference if you're in the ER, because measles is a huge public health issue, and once you publish that you have a patient with measles, it's just mass chaos. So it's something that they desperately want to be able to screen accurately. So here, these spots in the mouth are the differential. So they would have the patient, they would actually take an image of the spots, because as you can see, of course, like screening inside the mouth can be just as difficult as screening something on the skin when you're an ER physician as well. The accuracy rate for that is 50%. So our 98% accurate screening tool can help them do that diagnosis quicker. So here measles is actually the closest match, but it shows you the other ones that match up similarly to that. You can see how it would look on different skin tones on that same part of the body or any other part of the body that you would like to query from. And one of the challenges that we were approached with was from dermatologists, is that when they get a derm consult from an ER doctor, it doesn't make any sense. So we provided the derm consult using an LP to just expedite the process using the proper terminology and morphologies. So yeah, and then they can also learn about the similar looking diseases. If they're still hesitant or suspicious, they can look into all of these and do something similar where they screen different cues on the body for that. So that is our ER doctor facing portion. Sorry, this thing, Windows in here. Yeah. So in the US, around $132.2 billion are spent on healthcare. And $74 billion is the overall health IT budget for US clinics, and it increases 8.8% year over year. We fall into the health IT bucket rather than the teledermatology bucket. We've recently discovered, because we are more of a data-driven tool than an actual communication with the doctor tool. So the projected expenditure for dermatological apps in clinics is around $2 billion. So this is our core team. I'm Charu. I'm a machine learning engineer and the CEO of Etta. My co-founder, Joanna, is a software engineer, and she's our CTO. Dr. Regan Anderson is our core dermatologist of our team. We've actually just added another one a couple days ago. Her name is Mariam Tatachny, and she's at Yale. She's a dermatologist at Yale. And we brought her on because she has worked with almost every single health IT tool in the dermatology space in clinic, and she had scathing reviews and feedback, and she just had a lot of great insight on how to make a tool actually viable in the clinic. So we pulled her onto our team as well. Dr. Prakirti Yeram is a pharmacy oncologist, and she is helping us with the treatment planning around melanoma, rashes, all skin diseases, in order to make that also simple in and out of the clinic. One of the most exciting things about what we do is that we get a lot of patient feedback, and often 43 times the feedback that we've gotten is, you screened something on our skin, I took it to the dermatologist, it ended up being cancerous, here's a testimonial. So that's been really great to have, and we're excited to sort of increase that number through partnerships and integrating into different other existing telehealth companies. Yeah, I'm Charu, and I'd love to hear all of your questions.